Thank you. So we're going to tag team this today. I guess I never actually thought of Pacific Coast Psychiatric Associates as a startup, but I guess it is our startup. So Udi and I, we finished our psychiatry residency training in 2006 at California Pacific Medical Center in San Francisco. And we were classmates in our residency, and we decided our favorite part of psychiatry was practicing outpatient mental health. And so he and I subleased some office space right down the street from where we trained in Pacific Heights and basically started practice from scratch. And what that meant was we started contracting ourselves with insurance companies, and Udi actually was a computer science major in college, so he forced us to be electronic and paperless from the beginning, which is probably the best thing he ever did. And we did our own billing on the weekends electronically. We would call patients back, do our authorizations, call the insurance companies directly about all of that. So I think we really learned the nuts and bolts of practicing psychiatry in the world of private commercial insurance. That's been our bread and butter. And we realized very quickly that our time was better spent seeing patients than doing all the administrative work. So in 2008, we hired our first employee. He's still with us as our billing manager today. And then we started adding psychiatrists, and we added psychiatrists and then realized we really needed to add therapists as well. Our training clinic was a very collaborative place, and that was sort of what we had envisioned in the beginning as maybe something that we would create. And so today we are a little over 30 psychiatrists and 30 therapists. We practice, started in San Francisco. We have an office in Walnut Creek in the East Bay, and then we recently this year added an office in Los Angeles. Our model is very collaborative care, so at lunch every day we do a very informal case conference, whoever's there in the office. We also do some virtual case conferences as well, and so it really helps the psychiatrists and the therapists really share cases, share ideas, troubleshoot problems, and so we do have some staff now, to about 12 office staff, and our main population is, we contract with most of the commercial insurance companies, and we have child and adolescent psychiatrists, adult, and the geriatric population. Our population in San Francisco is really what drove us, I think, to telemedicine. Actually, is growing up, so to speak, in the tech bubble of the world. Our patients that we would see were employees at Facebook and Google and Apple, and they would wonder why they couldn't sync their appointment time on their phone with our software. We had to teach them a little bit about HIPAA, but the idea was there. So now we are a pretty comprehensive clinic across California, providing psychiatric evaluations, medication management, and therapy for children, adolescents, and adults, and couples work as well. So originally, I guess telehealth for us was in 2006, 2007. If I had a college student who was going abroad, the idea of finding an English-speaking psychiatrist in Prague was unheard of, and so we would use Skype, and parents would pay out of pocket for those appointments, but at least we could continue care while students were studying abroad. About 4 or 5 years ago, we realized that we need, there's sort of the onset of much more HIPAA compliant video conferencing platforms, and the American Psychiatric Association on their website had about 4 or 5 companies they endorsed. We decided, our office manager at the time helped us do a lot of research on the different companies, and VSee was actually the most user-friendly and most secure that we felt at the time, and so we've been using VSee ever since. We originally started with the practice, like I said, the college students abroad, but now the buy-in from the patients really is, I have an appointment with someone, they're traveling, they're stuck in New York, They didn't realize that they were supposed to get on that last flight of the night last night. They didn't get on it. Now they have to cancel the appointment. One, they're getting charged for their late cancellation. That's a very common practice, right, in mental health. Two, my next appointment is 2 weeks from now. So now we're all in a quandary. You know, I changed a medication. I really wanted to check in. They really wanted to check in with me. So very easily, once we offered a telepsych appointment, people really appreciated it for those very obvious reasons. Other scenarios, you know, someone is stuck at home with a sick kid, they can't come in, well, they can get on, you know, their computer and do a video appointment. Excuse me. And then from the provider side, we actually, about 2.5 years ago, we had United Healthcare approached us to do a direct-to-consumer pilot. They knew that we were very tech-forward. They'd been to our offices in San Francisco, and so we really started doing new patient appointments. So originally it was just to existing patients we had seen in one of our offices, and something came up and we did a video appointment. But now we started really doing new appointments, which was a huge learning curve from providers because medicine is much slower than technology and people don't want to change. So Udi and I first started doing these ourselves, where we would see patients in the privacy of their own home, or they would be at the office, but they would have a conference room that they would go to, or they could shut the door at their office. And I think that that's where we really realized that it's just, you know, the face-to-face, whether it's via video or in office, is just as good. And I think also for us, we actually had a psychiatrist on medical leave. She couldn't walk, and even though she lived about 10 blocks from our office in San Francisco, she couldn't work. And so we realized, why don't we offer her to do telepsych from her home? And she started with a couple hours a week, and now does 20 hours a week. She's still actually pretty impaired, but she does 20 hours a week from home via telepsych. So now we have about 9 psychiatrists that do purely telepsychiatry and 5 therapists that do teletherapy, but most of the people in our office across the state do some hybrid where they're in the office a couple days a week, but then they're also working from home, seeing patients. And I would say about 40%, 35 to 40% of our office visits now to date are telemedicine. I'm going to let Udi take over.
Okay, so one of the things, and it was actually brought up by the previous speaker, is why would patients use telepsychiatry? We are based in San Francisco, Walnut Creek, LA, so these are places where there are psychiatrists available in our offices. They can come in. So that was the patient side. But then we also realized, our doctors, some of them were very anxious about doing telepsychiatry. And so we had to kind of show them that there was a benefit. One was to get patient feedback. Continuity of care, like Anisha spoke about, a doctor going on medical leave was able to keep all their patients. I moved a few years ago from San Francisco to LA. My practice was full. I offered patients to stay transferred to an in-office doctor. No one wanted that. They once you establish a relationship with the patient, they want to continue seeing you because it's disruption in care. Provider satisfaction, like medical leave or moving, but we have a lot of doctors who have young children, and working from home a day or two is great for them. Some doctors who commute, so if they could break the commute a day or two and work from home. So it leads to provider satisfaction as well. And then ability to recruit psychiatrists and therapists increased dramatically because we were now so much more flexible. They could live further away from the offices or have more difficult schedules. They could work in the evenings or weekends if they wanted to. So there was a lot of benefits to the providers once they started seeing the benefits. Then even providers, we have providers who've been in practice for 30 years and are embracing this and really enjoying the benefits. So for us also, for patients and us, being able to access providers with different specialties, so like the addiction psychiatry, geriatric, child and adolescent. Even though we started with just doing adult services for Telepsych, we are also, about a year ago, we started doing child and adolescent services via Telepsych, which has been great. There's so many benefits to being able to see the child at home, the parents, conferencing with teachers, and so forth. So the other thing is we wanted to prove to ourselves, we thought that Telepsych was great, but we wanted to kind of prove to ourselves that, yes, it is a benefit. Again, we are in an urban setting. People can go to the office. So we created this survey that we would email patients after they had some experience with telepsychiatry. 5 questions, just rating from 1 to 5, 5 being most positive, and then also gave them a chance to putting in a narrative. And as you can see, so 5 questions about how easy it was to set up the video conferencing software. And again, we chose VSee because it was very simple, and it was very simple and easy for patients to use and for us to use. The quality of the video and audio didn't make it easier for them to keep their appointment. Do they find it useful, and are they likely to continue it in the future? And overall experience, as you could see, the average scores are very high. And then these are quotes directly from patients. So mentioning the comfort of having a session from their home, they wish all doctor used it, had all the benefits of being in person. People who live outside of San Francisco able to meet midday rather just early morning or late day during their lunch hour. Easing stress, seamless experience, much easier to keep appointments, just as effective as in person. Cost of, so again, even in the city, yeah, there's more availability, but it's busier to deal with traffic, tolls, parking. People with more inflexible schedules find it really useful. So a lot of very positive feedback. And we also, some of the criticisms I wanted to share. Some patients already had an established relationship with the doctor, so they find that they're wondering how would it be without having that established relationship already. Although we now offer Telepsych from the get-go and are getting the same positive responses. And some people kind of saying vaguely there were some aspects of in-person psychiatry that are missing, but then still saying it's a reasonable enough facsimile that it allows them to keep their appointments. And now there is more data and studies that show that there really is no difference. And I personally think data will eventually show that there's actually a better outcome than in-office. So some of the things you definitely need to do is setting limits with patients. Over time, we've become more comfortable. Yeah, you could do it in your car if you're parked somewhere and it's a private space. That's great. But obviously, you can't be driving. There can't be other people in the room. You can't be in Starbucks where there's other people. And for the providers who maybe just do it from home, maybe isolation, although there are plenty of providers who seem to love that, and that does not bother them. And patient education. showing, kind of teaching patients what it is. It's interesting. We do advertising and like Google Words, and last month there were about 1,400 people actually searching telemedicine or telepsychiatry. We'll show you a video now that's on our website that we kind of use to kind of educate patients.
At PCPA, it's actually been quite So telepsychiatry is something that we offer here at PCPA. It's actually been quite life-changing for patients and providers. It's basically having a session with your provider via a HIPAA-compliant, secure video conferencing platform. You can download it for free to your computer or mobile device, and you'll be ready to go in just a few minutes.
Kids are sick, and I just don't feel comfortable leaving the house.
Yeah, no, I understand. In the past, there were thoughts of, you know, the relationship with the doctor. Do you really get that in telepsychiatry? But I think what we found is that it is really effective and can really provide patients with access to treatment when it might not be possible otherwise.
It's something that's been proven to be effective. The mode in which you talk to your provider doesn't change. It doesn't become any less effective. It's kind of a nice way to use technology to blend with what we can provide here at PCPA.
Teletherapy and telepsychiatry have both been really helpful as far as continuity of care. Patients have really appreciated this form of treatment. There's no commute or parking hassles, and if they're out of town, so long as there's an internet connection, they can have their session. The reality is, life happens, and people can still get the timely treatment they need.
So that's our presentation. We can
I have a question. You said your 40% patients are almost on the telemedicine now, telepsych. So if you do the cost analysis, if those patients was coming in your offices now on the telepsych, so what you're getting finally and what your expenses, you think is worth it doing that financial-wise?
Well, I don't have the exact numbers, but we're definitely we are saving in cost as far as office space for example, the doctors that work from home. We don't have a space we don't need to pay rent. As far as the support staff, that I don't think that makes a big difference. You need to support those patients, those doctors, whether they're in office or at home. So if anything, there is definitely saving costs for the doctors, for us, and for the patients. I don't know if does that.
Yeah, the question is that you're not getting the same reimbursement on those.
Oh no, we are. We're getting this exact same reimbursement.
From insurance?
Mm-hmm. And in fact, like the previous speaker says, now insurances are coming to us and like they're pushing telepsychiatry. Can you do more? Can you get more doctors to do it? Because they finally realize that this saves them money.
Your satisfaction rates are all very high. I was wondering, did you see any difference according to age with regards to the satisfaction?
You know, that's interesting. Those are just from adult patients, because when we started doing the survey, we were only offering adult psychiatry services. Yes, and you know what's interesting is that even the older patients, we find that they really like using their phones for the session, and that's because a lot of, my mother is 70 years old, has never touched a computer, but she's on her phone all day, texting grandkids, photos. And so if I have the patient we use the VSee virtual waiting room, I can have them download the app on their phone, and I can test it with them. It really takes a minute. That's what we love about the virtual waiting room. Once they have it on their phone, all they have to do is click on it and have the session with me wait. So yeah, that's been amazing.
From a provision of care geographically, are you right now just limited to the state of California?
Yes, right now, because there's still so much need, we haven't ventured outside of California. We've kind of talked about it amongst ourselves, but right now we're just doing California.
Yeah, and have you looked at the logistics of that as well? I mean, just in terms of...
Crossing states?
Yeah.
Yes.
It's just that you have to have a lot...
There's a lot of different... So yeah, I actually have done a lot of research because we were talking to a couple different tech companies and their needs in rural Massachusetts or North Carolina. It's different state to state. And I know they're trying to come out with a consortium of states that are trying to get a sort of universal license, but it comes back to money. I don't think the state medical boards are really wanting to give up their every 2-year $800 they get per physician.
Just to add, if a physician has a license in another, like we have a physician who moved from Philadelphia and are still seeing their patients in Philadelphia because they have that license.
So let me ask a related question. When your patients are traveling, technically, when they're existing in another state in which you're not licensed, it might be interpreted as you're not eligible to be rendering services there.
No. So in California, at least according to our malpractice carrier, CAP-MPT, because this goes back to because you are going to get sued in the state the patient lives in, I think is really the bottom line. But as long as the individual is a permanent resident of California, you can see them in Hong Kong, you can see them in New York, it doesn't matter. It's wherever they live. So, ironically, I have a patient, she is a resident of Georgia, but she works for a consulting firm and she comes to San Francisco. I can see her face to face when she is in my office in San Francisco, but I cannot do telepsych with her. The nuances you learn along the way.
Was I correct in seeing that you use this for medication management? And if so, do you have any statistics or benchmarks to show that you have an increased adherence for medication management?
So it's not just for medication management, it is for psychotherapy as well. But we don't have numbers, although I could tell you clinically, definitely, and that's what we're working on now, is creating an electronic system that can actually track that data and show that. But definitely patients are more likely to show up on time, and even if they are coming into the office, if they're not doing well and they call me or message me, I can say, I can see I have an opening at 1 o'clock. Can we meet? And because it's via video, they're much more likely to be able to do that wherever they are. They're at work. And so I can provide more acute treatment more rapidly and get them to stay on the medication or adjust it more quickly so that they get through that. So absolutely, but that's what we're working on now, to actually show data.
Hi. So 2 questions. First one is, have you ever tried to do group counseling through group video conferencing for maybe psychotherapy? And then the second question is, obviously you've done hundreds of visits at this point, and I guess in San Francisco it's relatively good internet connections. People probably have relatively up-to-date hardware, but I'm sure a small percentage of the time there might be an issue with maybe a patient doesn't have an up-to-date computer, or their bandwidth is slow, or maybe they're just having difficulty launching the call for the first time. And so what percentage of the time would you say like technical issues get in the way? And I'm assuming most of that would happen in like the first session and then kind of work it out. But also just curious about that as well.
Yeah, I would say that it's a very, very, very low, I don't know, maybe 0.5% or less. And if that is the issue, it's more maybe some cutting off. I think, and over the past few years, it's been getting better and better. The reality today is all they need is their phone, too. Sometimes if they might be in an office and there's some interference, they say, well, let's switch to your phone, do the app, and it's really good. And so we are seeing patients in California, also outside of the United States, and it's really not a problem. We would have thought it would have been a much higher percentage. And regarding the groups, yeah, we are thinking about that, and in fact, they're talking about the socialization. And so if we can connect all our patients, we have about 5,000-6,000 patients, maybe where they could do group, they can connect with each other even and do formulate a group for depression, or it would be so valuable. And that remains to be seen. Is it better to have one of our providers monitor that group, or let the patients kind of do that themselves? But there's so much potential for that.
I gathered that you primarily do commercial insurance, and so in our environment we have lots of different commercial payers who then farm out to multiple third-party administrators who then also offer very customized packaged benefits. And so how did you figure out how to verify the patient's benefits, cost share, copay, et cetera, and integrate that into your telehealth system?
That's changed over the past few years, actually. I think most of my hair has gone gray over trying to answer that question. And I think that we actually, so United Healthcare came to us and asked us to do a pilot. I think we realized that there are California telemedicine laws that have been in place since '97, I believe it is, and so trying to figure out what legally they can do and not. I think actually a lot of the education has been us collaborating or symbiotically working with the insurance companies, and we've seen over the past few years now all of them come out with, okay, we cover teletherapy, we cover telepsychiatry, even though, when we first really started doing it, they would say we do, but then you'd call a rep and they would have no idea what they're talking about. So we had to figure out on our end what was, okay or not, and then, kind of work backwards. It's pretty complicated, I think, is what you're trying to magnify.
Do you have folks who are going into the insurance or third-party administrators' websites, verifying their coverage and loading that into VSee?
We do. So into our, not into VSee, but into our
Your
software.
own system.
Yeah,
Okay.
yeah, we do. We do. And I meet with billing.
So if a patient pays their copay on VSee, how does that translate to your system?
So they don't pay on VSee. So
Okay.
we just use VSee for the video conferencing.
Okay. Are you billing?
Yes.
Cost
So
shares? Or
So
copays?
we, I think why it's worked so well is because we had the model of how to see patients out in outpatient mental health via insurance, and then translating that, we do everything electronically, but we have it, one receptionist who's our virtual waiting room receptionist, who interfaces with the chat box on VSee to, if something's missing or we need a credit card.
Updating their demographics, et cetera.
Right.
Even before
Thank
we
you.
started VSee, you didn't need to be in the office to do anything, because payments were through the portal. If I wrote a letter to a patient, I can write the letter in the EMR. They sign to the portal. It's available for them there. So there's nothing that they can do in the office that they can't do remotely.
Thank you so much for that really insightful talk there.